Dr. Brandon Evans here, the owner and founder of Proactive Physical Therapy and Wellness in Louisville, Kentucky. In this video, I'm going to discuss what is pain, how does your body perceive pain, and how can physical therapists help alleviate any pain that you may be having to allow you to get back to doing the things you love with the people you love. So, let's jump right in. Within your body's muscles, tendons, ligaments, organs, pretty much any bodily structure except for your brain, you have these receptors. And these receptors are called nociceptors. And their primary job is to do three different things. One, they detect any type of pressure changes within bodily structures. Two, they can detect any extreme temperature changes, whether it's hot or cold. And three, they can detect tissue damage. So here, we have your femur or your thigh bone, and we have your tibia or your shin bone. And on either side, let's call these ligaments. And what a ligament does is it helps to support two bones, or it helps to protect a joint, which all a joint is where two bones connect. Now, let's say you're playing sports and you go and you twist your knee and stretch a ligament. It's represented here. Now, I'm going to preface this. I am not an artist and I do not claim to be, so please bear with me. So once that ligament gets stretched, what it does is it starts to release chemical signals, kind of like SOS signals. And these signals are saying, hey, or your ligament is saying, hey, something's wrong. I've been stretched too much. If something doesn't happen, I could potentially tear, or I could have severe damage. And it's the responsibility of these nociceptors to receive these chemicals. But nothing will happen until enough of these chemicals are released. And once enough of these chemicals are released, what happens is we call it action potential, which is represented here. So let's say this is a threshold, and as long as the signal stays below this threshold, nothing will happen. But as soon as this ligament releases enough of these chemicals and it crosses this threshold here, that's when the action potential happens. And what that is this nociceptor turns these chemical signals into an electrical impulse, and it takes these signals and it sends it to the spinal cord, and then it sends it up to the brain. Then it's up to the brain to perceive this pain and decide what is the correct response to alleviate the issues that are happening down here. Now, if this was a muscle, the brain could actually shut that muscle down to try to protect that tendon. So where does physical therapy come into play? It is our responsibility to come in, and if it's a ligament, we need to go and give this ligament support. Maybe that's strengthening the muscle. Maybe it's taping the ligament to give it the support. Because all we're trying to do is get this signal to drop back below this threshold. Therefore, this ligament stops releasing these chemical signals, and that sensation of pain starts to diminish. If it's a muscle, what we need to do is we need to go in and maybe dry needle the muscle, stretch the muscle, strengthen the muscle, cup the muscle, or what have you, so that it will stop releasing these chemicals. So that is a real brief overview of what pain is, how the body perceives pain, as well as what physical therapy can do to help you alleviate any pain that you're having, so then you can get back to enjoying the life you deserve with your loved ones. Like always, if you have any questions, please reach out to us. Our number will be below this video. I hope this helps. I hope you guys have a great day, and I hope you enjoy some of this warm weather. Thank you.